Great. So I'd like to thank everybody for joining us today for UNC's Health Media Briefing, featuring two infectious disease physicians and researchers with UNC Health and UNC Medicine. These COVID-19 experts will share their expertise on coronavirus. We'll post an unedited copy of the full briefing on YouTube and Dropbox after the call. You can also record yourself for the media. If you'd like to record the call directly from Zoom onto your own hard drive, there's a record button at the bottom of the Zoom panel. Just click on that, and then I'll be able to authorize you for direct recording. And that has to be done on an individual basis. So please send me a chat message if you're requesting to record. We'll also have an audio file, and that can be emailed to radio stations, folks that use it for note-taking purposes, because we have a number of folks that do that. So just to get underway, today's infectious diseases experts will take on a number of questions on coronavirus and COVID-19. And I will now turn it over to my colleague, Alan Wolf, and he will introduce today's health experts.
Thanks for joining us, everyone. If you could mute your lines or phones until you're ready to ask a question, that would help with the audio. Dr. David Wall co-leads a respiratory diagnostics center at UNC Medical Center in Chapel Hill, where outpatients are tested for COVID-19. He also helps treat COVID patients. Dr. Wall is part of a leadership team for a large nationwide NIH-sponsored trial testing hydroxychloroquine and azithromycin to treat COVID-19. His research focuses on serious viral infections, including HIV and viral fevers, including Ebola in West Africa. Dr. William Fisher is an associate professor in the Division of Pulmonary Diseases and Critical Care Medicine at UNC. He specializes in severe viral infections, including Ebola, Lassa fever, influenza, and COVID. He helps treat patients in the ICU and has been deployed internationally by the World Health Organization in response to the COVID-19 pandemic. He also leads treatment studies to identify effective therapies for COVID. Thank you both for joining us. Dr. Wall, would you like to kick us off with just a couple opening remarks about some of the work you're doing?
Yeah, thank you very much, Alan, and thank you, Phil, and everyone for being here. I think this works out really well that my work partner, Billy Fisher, we go all over the world together, including West Africa, responding to Ebola, as you mentioned, but now I've been working hand in hand here, and he'll tell you a lot about what we're doing on the inpatient side, where he's been concentrating a lot of his efforts, but not exclusively. He's doing a lot of other things too. Whereas I've been working a little bit more on the outpatient arena, trying to develop really good testing strategies so we can identify folks before they come into the hospital, or folks from the community who may have symptoms of COVID, working on that. And we're both working together on research, as you mentioned. But I think more importantly, Billy and I are really part of a huge team that mobilized early once we started to see that this was going to be a problem, and recognized, as many others did, that we have a serious pandemic on our hands. And part of a large team of people who have been able to mobilize across the state in really leading in how do we set up all the elements we need, right? So we need to identify people who are infected. We need to isolate them so they do not infect other people. If there's treatments or things we can do to help them from progressing, we do that. We help take care of their contacts so that those people are followed closely. And then people who need care can get that care, either as an outpatient or an inpatient. And that's where Billy takes over. But also we have to understand more about what we can do to understand how we can better prevent and treat this infection. So I'll let Billy take it from there, but I think we've got a multi-pronged approach with a lot of wind in our sails from the system and the support from the state and other partners that have really made this, I think, really a well-oiled machine at this point.
Great. I'll take it over from here. Thanks, Alan and Phil, for the invitation to be here. And thanks, David, for those opening remarks. I think you hit the nail right on the head. David and I have been involved with outbreak response now for a little over 6 years, involving a number of high consequence pathogens. And I think David said this really well, that outbreak response is really a multi-dimensional effort, and it begins and ends with community engagement. And so I think from the perspective as clinicians and members of the community, I think that we view UNC's role as closely linked with the community in both the fight against this pandemic. I think if we take a step back and look at where we are today, this outbreak was first recognized in very late December, and in the course now of a little over 6 months, a little over 5 months, excuse me, there's over 6 million cases that have been reported to the World Health Organization, and just under 400,000 deaths. So in a very short period of time, this infection has emerged from a local area and has spread widely around the globe, affecting people's lives in many different countries. So there's been a concerted effort, both domestically, nationally, as well as internationally, to try to fortify the response. And I agree with David. This begins with community engagement, and then extends into really trying to identify people as early as possible. And the key behind the identification of patients early as possible is that we can both stop ongoing transmission of that infection to people within their homes and their communities, but also really give them their best chance at survival. And so, due to the effort of a number of incredible people at UNC, we have, including a couple people in particular, Keisha Brown, who is nurse manager on 6th Bed Tower, and Luck Culp, who is the nurse manager in the ICU. We've transformed parts of our hospital to COVID-specific care units, where patients can receive state-of-the-art care for COVID. And that care can be provided in an incredibly safe environment. And so that transformation was really instrumental in terms of us being able to provide really high level of care to patients who are really critically ill, and to do it safely. And so I think we've achieved that balance really nicely. And that has prepared us to care for a large number of people who've needed it. You know, in the care for patients with COVID really requires both aggressive supportive care, as well as potentially antiviral therapies. And so David and I have also been very active along with the University of North Carolina, in trying to identify interventions that are both efficacious and safe. And so we're also happy to talk about the research efforts which have been launched at UNC and internationally. And I'll stop right there. David, you want to talk about outpatient diagnostics?
Yeah, I don't know, Alan, Phil, is it time for questions, or I want to make sure people have time to get.
Or let's see if you have something to talk about, but let's ask questions, because we want to get many questions as we can in. So members of the media, if you would like to ask a question, please unmute yourself and then just go right ahead and ask your question. If you have issues with your recording, you can send a chat message and we can ask that on your behalf too, but please just step right up and ask.
Hi, good morning. This is Richard Stradling from the News and Observer. Thanks for doing this. I'm wondering what you all make of the increase in hospitalizations. That number has fluctuated, but it has remained between 400 and 600 from about mid-April through May 24th, and now is hovering around 700, 675 to 700 in the last week or so. And I'm wondering what you all think is going on there and what the significance of that is.
Yeah, I'll take first stab, and then I'm going to ask Billy his opinion. You know, I think the metrics that we need to follow are a little problematic, right? Because when we talk about number of cases, that's very dependent upon the number of tests we're doing. The more tests we do, the more people we find. If you're not doing tests and you have 0 cases, that doesn't help you. So testing is fraught with a little bit of difficulty, and case numbers are difficult. And one thing you can't really hide are hospitalizations. And I think that's really the truest canary in the coal mine for us. If we're seeing people get sick enough to be admitted to the hospital, that's telling you we've not flattened the curve. And so this is the best indicator, I think, that we have of where we are with the pandemic. And so it is concerning to me. The other important thing, Richard, is to really recognize that when someone's admitted to the hospital, what we're really looking at is the state of the outbreak 2 weeks before, because they didn't get infected the day before or the day before that. People who get sick in the hospital and enter into the hospital generally have been infected maybe 2 to 3 weeks prior to that and have been symptomatic on average about 10 days before they get into the hospital. So it's really just a concern. I think if we're going to see an uptick due to reopening, due to the protests that we're seeing, it's not going to be tomorrow. It's going to be another 2 to 3 weeks from now. Billy, your thoughts?
Yeah, I think, David, I agree with you. Richard, thanks for the question. I'm certainly concerned. I think that we've seen that social distancing, hand hygiene, and masking have worked to keep the numbers lower. And as we open up and as some of these social distancing practices get relaxed, we're going to see more cases. I'm not surprised the case number has gone up. In addition to the numbers of hospitalizations that David spoke about, which I think is a really important metric, I also think the percent of positive tests is another important metric that we need to follow. Because as we expand testing, and we need to expand testing, as we expand testing, my hope will be that we will identify people who are infected initially, so that we can get them into the care that they deserve and need as early as possible. But then if we're effective in identifying those populations that are infected quickly, we should then see a decrease in the percent of positives, because as soon as we get those people into care, we can prevent ongoing community transmission. So I think percent positive is going to be a really important metric. And I think, to brag a little bit, I think David's leading this effort in a major way, both in terms of expanding testing in an outpatient facility that makes it easy for people to get tested, but also in terms of making sure that that marginalized groups have access to testing and expanding that testing to at-risk populations. And I think this is a key thing that we have to do as a state, that we have to do as a country, is to make sure that everybody has access to testing, so that when they become symptomatic, we can identify them and get them the care that they need as quickly as possible.
Great, thank you. Additional questions from the media, just please make sure that you take yourself off of mute and just go right ahead and ask your questions.
Well, I have another one if nobody else does.
Go ahead, Richard, please.
Okay. I wanted to ask about the HERO registry. If the folks that are signing up for that are going to be involved in any of the research that you all are doing, and what do you all hope to learn from that group of people?
Yeah, thanks again, Richard. That's a good question. So for those who may not be familiar, there is an ongoing study that is federally supported through a mechanism called PCORI, looking at healthcare workers and broadly defined healthcare workers, people who are working in healthcare settings, and trying to understand a little bit more about what happens to them over time, including, I think, over a course of a period, looking at whether or not some of them develop antibodies to the virus, whether they were ill or not. Importantly, a big part of that is also seeing whether or not prophylaxis, meaning preventative therapy, works. And in this case, we're talking about a drug that's been in the media quite a bit, hydroxychloroquine, and whether or not administering this drug before any evidence of infection protects one from infection. That is a very unknown question. And as part of a multi sort of study effort to understand the role, if any, for hydroxychloroquine. So this is the prophylaxis part of that.
I'll jump in with one if y'all don't mind. This is Jason DeBruin with North Carolina Public Radio. First of all, apologies for being a little bit late. I was on another call actually related to this question I'm going to ask, and that is about the protests. Clearly, that's a lot of people all in one area. I know maybe this isn't exactly your bailiwick, but if maybe you could offer some thoughts on, are you concerned that the virus is going to spread pretty quickly because you have, in some cases, 1,000 or even 2,000 people, right, all in, in a little tiny area, sweating, screaming, shouting. It seems like just a perfect environment for the virus to spread.
Yeah, Jason, it's clearly, and Billy and I have talked a bunch about this. This is a big topic among those of us who are on the front lines. It was a big topic when we saw the protests in Michigan about the efforts to buck plans for continued lockdown and quarantining and isolation. And it's a concern now. The virus doesn't care if you're there protesting for one cause or another. It doesn't care if you're at a racetrack. All it cares is I'm inside of a body that's infected and I'm next to a susceptible host. So if you've got a susceptible host in close proximity to someone who's infectious, you have opportunities for transmission. And anytime we increase that happening and the concentration of folks who are infected next to people who are not infected, you get transmission, whether that be in a meat processing plant, on a farm, in a correctional facility, or during a very, very
So
Sorry.
I might just add, so Jason, thanks so much for asking that question. And I agree with everything that David said. And I think and I would emphasize a couple of things is that it's not just the protests, but it's any situation where people are in close contact, like David said. So there are a lot of work environments in our state and others where people are in very close proximity. And so I think when we find ourselves in those situations, many of which are very, very important to be in, we just have to take the right precautions in order to mitigate those risks to transmission. And so it's not just the protests that concern us, but it's the work environments for a lot of citizens in our state that I think we also have to take into account. So thanks for that question.
This is Laura Leslie from WRAL. And so since we're a little bit since we're looking in that direction anyway, just wanted the public health perspective on the idea of holding a full-blown presidential nomination convention in Charlotte in late August. We had heard that the RNC folks were reluctant to agree to social distancing and felt it could be done safely without distancing and without requiring masks. And I'm curious to know what your take on that is.
Yeah, Laura, I think one of the things that has been somewhat disheartening to those of us who are working hard on this, and I've spoken to a bunch of people, I think as has Dr. Fisher, is how politicized a lot of this has become. And it's a shame. People are canceling weddings. People are canceling confirmations, bar mitzvahs, bat mitzvahs. There's a lot of things that we've done differently. And while we may wish we can do those things and be close to one another, the reality is it's dangerous. And we've seen personally within the last 24 hours, people who are struggling for their lives, trying to get oxygen into their system, but can't because of this virus. And we don't know which one of us who gets infected has an easy course and which one of us turns out to be like that. And so until we find a better way to figure that out or prevent it from happening, it's just plain dangerous to have large groups of people together. Again, like we talked about, we're worried about the protests. We're worried about conventions. We're worried about massing people together. That's exactly the opposite of how we got to where we are now. We've been able to be highly successful at proving some of the models wrong. And the models didn't think we would do as good a job as we've done in distancing and staying home and shutting down. We've really done a tremendous job, and I worry that we're rolling this back way too fast and too hard, sometimes for not the right motives.
Yeah, I might jump in there. I agree 100%. And it's not just about COVID. The thing about these outbreaks is that if an outbreak overwhelms the healthcare infrastructure, you not only have difficulty providing care to the person with that particular disease, but you have difficulty providing care for every other disease. So if the hospitals become overwhelmed with COVID patients, it's very difficult to take care of the patient who's the pregnant woman who's giving birth, or the gentleman who's having a heart attack. And so I think David's right. I think we have to be very cautious right now. We have to do the basic things well. We have to do everything that we can to prevent community transmission of this disease in order to ensure that the healthcare systems around the state, around the country, around the world are able to provide both excellent care for patients with COVID, but for every other disease as well. And so I think this is a really important factor, is that we can't forget about essential healthcare service delivery, in addition to that care that's required for COVID. So I think mass gatherings without hand hygiene, without masking, it's a dangerous opportunity for the virus to spread.
Additional questions from the media, please just jump right in and ask our guests.
Yes, This
Go ahead.
is Jody McCurry from CBS 17. I had a sort of a basic question to ask. I'm tracking sort of the data between hospitalizations and deaths, and I'm wondering if there's ever a straight line between when a spike in hospitalizations occurs and 5 or 6 days later the spike in death occurs, or is that not a fair line to draw?
Judy, I'm not sure. Thanks for your question. I'm not sure I understand it. Are you asking if there's a correlation between in the timing from hospitalization to death?
Yes.
Okay. I think it's hard to say without analyzing systems level data. I think that anecdotally, we typically see people develop more severe manifestations anywhere from day 5 to day 10 in their from symptom onset. But I can't tell you without looking at systems level data whether there's a close correlation.
Helen, I think you were trying to ask a question.
Yeah, hi, this is Helen Chickering with Blue Ridge Public Radio in Asheville. So the state is now publishing recovery rates, but it seems there's not a true definition of recovery. How do you define recovery, and what are you learning about recovering from COVID-19? Thanks.
Yeah, I don't know. Billy, do you know the definition that the state's using for recovery?
I don't know that there's an official definition. I think it's a really, really important question. And Helen, thanks for asking this, because I think it brings into view this larger idea that people still continue to have signs and symptoms of illness beyond discharge. And this is something that David and I have studied a lot related to Ebola virus disease, in that the illness doesn't end with the clearance of the virus from your blood. In this case, we know that people continue to have ongoing signs and symptoms of illness beyond clearance of the virus from their lungs or their nose. And so I think that this is a really important topic that needs to be studied, that needs to be supported beyond discharge. But I don't know the current definition that's being used, but I can tell you that I am hearing a lot from patients who are discharged that they do continue to experience some signs and symptoms of illness. And I think it's important that we investigate that further. And some of these questions do talk about the role of research, and I think of research really as platforms of learning, especially when new diseases emerge. It's critical that we continue to learn about these as quickly as possible to both inform the care of that particular patient, but also to inform public health interventions.
This is Jason DeBruin again, North Carolina. A bit of a personal agenda question as well with this one. Can you maybe address the difference between the N95 and the KN95 masks to the extent that that there even is a difference?
I'm going to pass on that, Jason. That's just outside of my expertise.
From my understanding, and Jason, you tell me if you've done more research on this, I think it really has to do with where the mask is manufactured, and that the K95 is manufactured in one particular place, and the N95. I don't think the material and the function of the mask differs that much from my initial search. But if someone else on the call has more information based upon their own personal experience in Googling, that would be great. But my understanding is that they're both effective. And we did see some data recently, and you may be also thinking about this, from a Lancet paper that did what's called a meta-analysis, where they look at a bunch of different studies together and group them in a systematic way. That does seem to indicate that for frontline workers, probably exposed to more virus than most people, that would even be in healthcare, the N95 or the 95 mask was better than a surgical mask. We're still trying to figure out how that translates to just simple things that Billy and I might do versus some of the more intensive things Billy might do in the ICU.
Great, thank you. We got just a few more minutes. Additional questions from the media, please just jump right in.
It's Helen Chickering again. Your role as researchers, especially your work together with Ebola, what are some of the lessons you've learned that you are playing out here with COVID, or what are some of the questions that you'd like to take on as research projects going forward?
Yeah, we could talk about this a really long time. So Billy and I are passionate about this. What we witnessed in West Africa was not only an extremely slow response to the growing crisis clinically, but we also saw that the research response was horribly, tragically delayed. And there were missed opportunities for us to understand much more and do more, because subsequently, with another outbreak under much more difficult circumstances that Billy deployed to with bullets flying overhead, that's where we had to learn the lessons we didn't learn in West Africa, in the Congo. So in the DRC, we learned about which therapeutics work and which don't. That could have been done in West Africa if we'd had the time. So bureaucracies, over planning, all those things play. We worry about the same thing happening here. We are really aggressive about trying to understand, answers to basic questions. Some of the questions that you're asking today. What does it mean if someone has a positive, swab test in their nose 28 days after their symptom onset? We don't know if that really means they still have infectious virus. How infectious are people? Is 6 feet enough, or is it not enough? What about surfaces? What about therapeutics? What medicines prevent it? What medicines treat it? The list goes on and on and on. Are antibodies protective? These are really fundamental questions, and they're not going to get answered unless people agree to be part of the research and that it's supported and that we all are in this together. We don't want people to be guinea pigs. We want them to be participants and people from all walks of life. So Billy and I feel everyone deserves an opportunity to say no to a research study, but they should be offered it.
Great. Just any final thoughts on any positives or any bright spots going forward of where we are now?
So I know we started off with a count of how many infections and how many deaths there are. But I also want to say that in a very short period of time, researchers around the globe have been able to identify the virus, sequence the virus, and identify at least one therapy that looks like it has some efficacy against this virus. I think, and that's in the course of really 4 months that all of those things were identified. And so I think it speaks highly of the research community collaborating together to really try to identify effective therapies. And so I think that's a great start, but we have to continue. There's a large effort right now in getting vaccines ready for testing, which is very exciting. David and I are working on a couple of new therapeutics, which we think hold important potential, but have to be evaluated. And so I think the scientific community is mobilizing quickly. We always wanted to mobilize quicker, but I think that we have mobilized quickly right now to establish platforms. The AIDS Clinical Trials group, of which David is a leader, has really set up a very nice platform to evaluate therapeutics. So I think those systems are in place. Now I think that we have to continue to invest in them in order to make sure that we can identify which therapeutic interventions, which preventative interventions are able to have efficacy against this virus.
I would just add real quick, the thing that's been the brightest spot for me, to be honest, and this has been a horrible time for all of us, clearly, but I do have to say, I have been really proud and heartened by just how well people in this country have done. They have taken the messages to heart. The majority of people do care about this and try not only to not get infected, but people are really taking care not to infect other people. And sometimes we get distracted by vocal minorities, and it's amplified, of course, through social media, which gives equal weight to any voice. But I really am just so impressed. People stayed home for a really long time. People took measures, and it cost them a lot, and it's still costing us a lot, but it worked. We could have gone down a very different pathway and been dealing with double or triple the numbers that we started out with here, that we recited, the deaths, the number of infections, the number of hospitalizations. So we don't want to lose that momentum. We don't want to lose the gains. And I think we're at risk of that. So the bright spot for me is we listened, we took care, and I think we have to continue to do that.
Great. Thank you so much. We are out of time. We've run over. I'd like to thank Drs. Wall and Dr. Fisher for joining us today. And a great thanks to all the media who had a really good turnout today. Thank you for all of your questions and your attention and spending time here, because we know you have a lot to cover. Just to let you know, we will also post a recording of this on YouTube, unedited, and then we'll also put it in a Dropbox if you'd like to download that for editing, and we'll get that up just as quickly as internet speeds will allow. And we will be back in touch and with another briefing next week. So thank you so much for joining us, and that concludes today's media briefing from UNC Health.
Thanks so much.